diagram, we're showing a picture of a woman who is to undergo breast reconstruction utilizing her abdominal tissue, which we call the DIEP, Inferior Epigastric Perforator flap. This describes the skin and fat from the lower abdominal region and the blood supply to this tissue. In a close-up view, the way the operation is performed, an incision is made around the lower skin and fat of the abdomen, just at the level of the belly button and below. And the skin is reflected with the fat, revealing the blood vessels that go to the overlying skin and fat. These blood vessels provide a very important circulation to the tissues. The blood vessels are within the muscle, the rectus abdominis muscle. So to perform the operation, it is necessary to cut open the muscle to be able to remove the blood vessel. Every effort is made to save all of the muscle so that a patient can have as normal function and strength as possible. However, one of the potential risks and complications of surgery is weakening the muscle, which in some cases can lead to hernias and bulges. The lower abdominal skin and fat, along with the blood vessels, are then removed from the lower abdomen, and then the abdominal tissues are closed. The muscles are stitched together, and the abdominal skin is stitched together. The tissue is then transferred to the area of the chest. Blood vessels are exposed from underneath the ribs. A small piece of cartilage from the rib is removed, exposing the internal mammary artery and vein, which are then connected to the deep inferior epigastric artery and vein of the abdominal tissue. This is done with use of a microscope. Sutures are used to stitch the blood vessels together. These sutures are finer than the hair on your head. Once the blood vessels are connected, we are able to restore blood flow to this tissue. Artery, which brings blood into the tissues, and veins, which bring blood out of the tissues to complete the circulation. Stitches are performed around the skin to stitch everything together. And in some cases, we will actually do a nipple reconstruction at a future date, as well as a nipple tattoo if that is needed.